everyone, this is Suprava. Welcome back to another session with me. In today's session, we will be discussing about ambiguous genitalia. Well, from the term ambiguous, what we understand is that it is not clear or it is not obvious, right? So that means it does not have one interpretation. And here, ambiguous genitalia means the genitalia does not have one proper interpretation. So we cannot, determine the sexual interpretation of the child. Well, it might be confusing. So for that, first we need to understand the normal sexual differentiation. And for that, we have certain steps. So the first thing is establishment of chromosomal sex at fertilization. Now, I think you are aware that for girl child, it would be, for female child, it is 46XX chromosome. And for male child, it is 46XY chromosome. So here, this is the first step of, for differentiation of the sex. So that is how, the sexual identity is differentiated. That is, for female child, it is 46XX, and for male child, it is 46XY. And the second thing is development of undifferentiated gonads into testes or ovaries. So what happens, there would be undifferentiated gonads into developmental fetus, and then for in case of a male child, that is 46XY, in that case this gonad would develop into a testis, and in case of a female child where the chromosome is 46XX, in that case it would develop into a ovary. And the next thing is that the endocrine function would depend on the gonads which is present in the child. So in case of a male child, the endocrine function would be different, and in case of a female child, again, the endocrine function would be different. So here, as a result of this, what would happen there, we can see subsequent differentiation of the internal ducts and also the external genitalia. So here what we understood is that the sex of the child would depend on certain factors. That is, the first thing is that the chromosomal sex at fertilization, whether the child receives XX chromosome or XY chromosome, that would depend, that would determine whether what will be the sex of the child. And then again, there is the developmental undifferentiated gonad, which would develop into a testis or maybe ovaries. So these things would determine the sex of the child. Now, in case if you're not able to, differentiate the sex of the child, or if you're not able to interpret the sex of the child, and then if you're having more than one interpretation, in that case we call it as ambiguous genitalia, where the genitalia is not appearing or not giving one interpretation, or we can say it is not giving you the idea of one particular sex. So let us move to the meaning of ambiguous genitalia. Now here the meaning says that when the external genitalia do not have the typical anatomic appearance of normal male or female genitalia. So that means you cannot determine the sex of the child as female or male, because here the anatomic appearance will be such which does not fall into any of these categories. So what we can see here is that the infants with ambiguous genitalia would have genes of either female or male, but also along with that they would have some additional characteristics of the opposite sex. So let us see how would these genitals appear. So the genitals may look either like a small penis or an enlarged clitoris. Also, you can see that the vagina may appear closed or resembling to a scrotum, or the scrotum also may show some separation which would resemble a vagina. And in some infants, we can see that they would have both the characteristics of male and female genitals. Also, you can find out that the internal sex organs would not match the appearance of the external genitalia. So, for example, a child who seems to have a penis may have ovaries. Next, moving on to the etiologies of ambiguous genitalia. So first, let us see what are the factors that might contribute to the cause of ambiguous genitalia. So in male child, first thing is it is idiopathic. So the most of the cases have unknown cause of having ambiguous genitalia. And then if there is lack of male hormone, so in a male child, if there is deficiency of male hormone, that might contribute to the fact of ambiguous genitalia. And then there is gene mutation, so that also considered as a cause of ambiguous genitalia. And then if there is chromosomal abnormalities, so as I mentioned earlier, that for a female child it is supposed to be XX, and for a male child it is supposed to be XY, right? Now if in case there is any there is missing of any chromosome, or there is extra chromosome, that would cause certain problems in the child, and that might contribute to ambiguous genitalia. Next, moving on to the etiologies for in a female child. So in a female child, it can be congenital adrenal hyperplasia. So this is a condition where there might be limitation in the production of hormones in the adrenal gland. So that would that might cause ambiguous genitalia. And if there is prenatal exposure to male hormone, or if there is tumor, in that case also there might be hormonal changes and the child might have ambiguous genitalia. Next, moving on to the diagnostic evaluation. So for diagnostic evaluation, first would be history collection and physical examination. So in history collection, the first thing that we would ask about would be maternal drug ingestion, especially in the first trimester. So in the first trimester, if the mother was taking any drug, what kind of drug the mother was taking, all those things we have to know at first. And then if there is past history of early death of infants, or if there is family history of affected family members or siblings who might have had hypospadias, cryptorchidism, or delayed puberty, or consanguineous marriage. So these things we have to get to know. We have to collect all the history about these things. Then moving on to the physical examination. So here in physical examination, the most important thing is examination of external genitalia. So these are some of the things which we would look into while doing physical examination, and then after that we would move with our investigation. So we would do ultrasound, and then we can also do genitography, which this would help us to visualize visualization of the inner sex organs. We can also do karyotyping for genetic study, and then apart from these things we can do serum electrolytes, blood sugar, and then hormonal study. And along with these things we can also do CT scan, MRI, and also exploratory laparotomy or laparoscopy. So these investigations would tell us what is the what is the cause behind ambiguous genitalia and how severe it is. Now moving on to the treatment. So here in treatment we have majorly two options, that is the reconstructive surgery and hormonal therapy. So first we will talk about reconstructive surgery, and this is different for boys and for girls. Now for girls, reconstructive surgery is less complicated than boys, and in girls the sexual function of the organs are not compromised despite of any ambiguous appearance. So depending upon the severity, the options can be chosen. Now here, if these, for example, if the girl is having a covered vagina hidden under the skin, that can be uncovered. And then if the girl is having testes, so that can be removed. And if there is excess masculine tissue around the clitoris, that can be removed. So they can do clitoris reduction. However, for boys, it is quite complicated. It's not that easy, but it's often successful. Now next, moving on to the hormonal therapy. So basically with the hormonal therapy, they would correct the hormonal imbalance which is there, and because of that, if there is lack of hormone production, or there is deficiency of hormone production, in that case they would correct that hormonal imbalance. And sometimes with the hormonal therapy alone, this ambiguous genitalia can be corrected. And if it is not corrected only with with the hormonal therapy, then the child will be having reconstructive surgery along with the hormonal therapy. Well, so that was all about ambiguous genitalia. I hope you have got a better insight about the topic. Thank you.